Welcome back. Respiratory syncytial virus, also known as RSV, causes infections of the lungs and respiratory tract. It's so common that most children have been infected with the virus by the age of 2. RSV can also infect adults, and most people recover in a week or 2, but it can be serious. Infants and older adults are more likely to develop severe RSV and would need hospitalization. To help us unpack is pediatrician Dr. Stephen Bau. Dr. Bau, good evening and welcome.
Hi.
Thank you for being here.
Thanks for having me, Nina.
I want to talk about what the possible causes are to consider in babies who contract RSV.
Well, causes, since we've had COVID, I think everybody knows a little bit about how viruses spread. Although I have the experience that people seem to forget very quickly about COVID. But essentially, respiratory viruses are usually passed on with particles. So as somebody coughs, they put essentially vapor into the air, and in that vapor is your particle. So now you inhale that, and then you get your infection. There's also possibilities of you coughing at an object, or you cough in your hands, and then you touch something. So the next person touching the same thing and then maybe just itching the eye contracts it that way. So respiratory viruses usually are taken in via the respiratory tract, but they can be ingested or even put on the eye as well. And then you would contract the infection.
What symptoms do babies with RSV show?
So most babies, most children will be having just runny noses. It's essentially just like a flu.
Like a flu.
So you get runny noses, you get maybe a little bit of a cough, you get maybe a little bit of runny nose, those type of just generic viral infection signs. And it's not particularly specific for respiratory syncytial virus. So you cannot make it out from, oh yeah, that guy has one.
Right.
You actually have to run tests to figure out, is it a RSV? And for most of us, it will be completely fine and harmless. But some of us are designed differently, and when the RSV hits, they will have a severe response. And that might be because of an underlying predisposition, such as in, for instance, very small babies. Or it might be because your genetic makeup is made in a way that you are just responding very badly to this. And the most common severe reactions would be a bronchiolitis or a pneumonia. So bronchiolitis essentially, pneumonia kind of, I think most people understand pneumonia, an infection in a certain area of your lung, and then you get infection markers, you get white cells reacting, and this lung just doesn't work properly. For bronchiolitis, it's actually, in my opinion, much worse. And the problem is that if you imagine the lung like an upside-down tree, your trachea is your trunk, and then it splits up, and it keeps splitting until it reaches the leaves. Those last little tiny twigs before you reach the leaves on the tree, that is where the RSV festers. It kills the cells in this area, and now you end up with a lot of debris in that. So that makes you essentially react like an asthmatic. Air can go in, but it's trapped, it cannot go out. Your lung gets very hyperinflated, you get your diaphragm gets pushed down, you can't breathe properly, you can't get rid of air. And the problem is that, according to literature, like 18% respond to NAPs, like the stuff that we give an asthmatic to get better. What we do see is about more 80%, so it luckily does respond, but some people are completely unresponsive because the problem is debris and mucus and stuff that's actually blocking the airway.
You mentioned that you'd have to run specific tests to detect the RSV, so what test would you run to detect this?
So there are essentially two different tests one can run. The most common one being a PCR, polymerase chain reaction test. So that is the same test that we would run for things like HIV to find out, okay, how much HIV you have in your body. So these are tests where we take the DNA and we amplify it and we multiply it until it's so much that we can actually measure it, because one little piece of DNA we cannot measure. And so we do that PCR reaction. The thing is that it mainly comes as a conglomerate with other infections together. So if you run this test, you test for something like 15 different diseases, and part of that will be your RSV. The problem is these tests cost quite a lot of money. If you want to run a respiratory panel, that's about $3,500 just to find out what virus it is. And if you have a mild infection, it doesn't really matter for you. If you know this is clearly viral, you don't really need to know, is it the RSV or is it the influenza or is it the parainfluenza or what is it? But if you have severe disease, we would like to know what is it, because if it's, for instance, an influenza, we have certain medications that we can give you. If it's some other virus like the RSV, we don't have antiviral agents that we can give you, but for certain things we do.
What is the recommended treatment for RSV in babies, doctor?
So, as I said, mostly it's symptomatic, okay? So if you have a runny nose, we will give you a decongestant just to open the nose. I prefer actually nose drops or sprays, because if you have to take a syrup, it first has to go through your body. It gives you other symptoms, gives you constipation and stuff. Some people prefer these ones, and if you have a child that really is abhorred when you have put something in the nose, maybe it's the better option. But generally, I like local stuff when you want a local reaction. So that would be something. Things like, for instance, vitamin C. Everybody of us, when we have a flu, we will take some vitamin C. Why? Because it boosts our immune system to fight better. Zinc. I like zinc, any zinc preparation, because all the enzymes that are fixing up damage in your body are zinc enzymes. So you boost the zinc, you have a bigger army to fix up the damage, and so stuff like that. So it's mainly symptomatic. Maybe cough syrups, although cough syrups don't really work with virus infections most of the time. So this is generally it. But if you happen to be one of the ones that gets a severe pneumonia or severe bronchiolitis, we would have to give you oxygen, okay, because you're not managing, your lung does not manage to get enough oxygen in. Or if that's not enough, we will actually have to give you pressurized oxygen, so that your lungs actually stay open enough that there is some air exchange. And if that's not enough, we even have to put tubes into your lung, so through the trachea, so that we can actually ventilate you. And worst case scenario, you will have to go to a machine called an oscillator, which is something that works pretty much only for children and neonates. And if that doesn't work, then you would need a cardiac bypass. So, which we don't have for children. We do not have that option at the moment.
Dr. Ba, unfortunately we're out of time, but your final remarks, I just want to know, for a mom who's got a little one and they get sick so often, how do you differentiate between, okay, this is just a cough and a sniffle, and this is something a bit more severe? Is it when the symptoms don't disappear over a long period of time, or
so for things like RSV, we know it goes away usually within a week or two. So, and for other viruses as well. So usually it only lasts for a week. You have a runny nose, maybe a bit of red eyes, maybe some sniffles, stuff like that. But the main thing is that with the respiratory viruses, as long as you don't have breathing problems, you'll be okay. So the big issues that you should watch out for is when a child starts having chest indrawings. Every time they take a breath in, the chest wall will pull inwards. It means that your lung is so stiff and so pushed down that your diaphragm, instead of pulling down the diaphragm, that your muscles, instead of pulling down the diaphragm in the lung, pulls sideways. And now it pulls it in here. The other things to watch out for is nasal flaring like a horse. So if you see your child breathe like a horse with the nose opening and closing with every breath, that is a very dangerous sign. Fast breathing, depending on the age group, anything more than 40 in any age group with no fever is considered a very fast breathing and should be considered that this could be dangerous. And the last thing is in very small children. You as an adult, you will try to lift your chest as you're breathing when you have to work harder. A small child cannot do that because the neck is not strong enough. So instead, the same muscle pulls and the head pulls down. So they will actually have what's called head bobbing. So every breath that they take in, their head goes down. Once you see that, that looks very abnormal, and people really realize this child is sick. So any child with any of those symptoms is either having a pneumonia or bronchiolitis until proven otherwise, and should have medical attention.
Dr. Ba, I appreciate your time this evening and being with us. Thank you so much.
Pleasure.
That was pediatrician Dr. Stephan Bauer talking to us this evening about RSV in babies. We'll be right back.